throughout the pandemic, one thing I think for so many of us, we have realized just how vitally important our health is. And what we put in our body is also very important. Let's bring in Allie Babcock. She is with the St. Joseph Mercy Health System, a lifestyle and culinary medicine coordinator. Allie, thank you again for being with us.
Thank you for having me.
This is really such a great program. Fill us in on the program itself and how it works.
Absolutely. So, our team is really proud to be going first in launching lifestyle medicine in Southeast Michigan. Lifestyle medicine is a holistic approach to really preventing, reversing, and treating chronic disease. And we focus on 6 pillars that have tons of evidence behind them and years of scientific literature about why these specific elements and lifestyle change really help us to achieve those lifestyle goals in that prevention and reversal of disease that we're looking to do. So what we know that attaining restorative sleep and eating a whole food plant-based diet, the way we move our bodies, the way we manage our stress, the way we avoid substances and our social connections all can help to achieve that goal. And so our program is really looking to educate our community and our patients through some different opportunities we have to experience lifestyle medicine in group classes or individual appointments.
So, we have started to notice that some of the insurance companies are trying to reward their clients and their patients for healthy lifestyle. Do you think we're going to continue to see that? And with, the goal being, let's prevent the disease in the first place.
I really do. With the Affordable Care Act that was passed during the Obama administration, we started to see that insurance companies needed to have preventative medicine, particularly appointments with primary care providers, as a completely covered benefit. And that really launched the beginning of what we see in healthcare as an initiative towards value-based medicine. And when we look at the current medical system, we operate in a model where if you're sick, we will treat you. We will prescribe a pill for this or a surgery for this. And we really don't look forward to that prevention element unless you are looking at the total cost of healthcare and the total cost of the care of that individual over the course of their lifespan. And that's really where preventative medicine and value-based medicine come in. And so I think that we are at just the tip of the iceberg in a revolution in healthcare where we do look towards preventing disease. And not only will we see insurance companies rewarding their members for actually, the success that they gain in that. But I also think that we're going to start seeing insurance companies paying for those services more frequently and more readily.
That would be such a great thing. And, throughout this pandemic, especially in the beginning stages, we know that some of the people that suffered the worst, they had underlying conditions to begin with. So do you think that because of COVID-19, it has started to open up the conversation about how we are living, not just individually, but really as Americans overall?
I really do. The thing that we have seen, I think, intimately within our own population of colleagues, as well as our patients during the COVID pandemic, is that people were looking for a solution to, do something about their chronic disease and their health in a new way. For the first time, health became a value for many people across America. And the chronic diseases, unfortunately, that have been comorbidities, such as obesity and cardiovascular disease and type 2 diabetes for our patients with COVID-19, have really one common denominator throughout them, and that is inflammation. And we really have a lot of evidence in lifestyle medicine to suggest that utilizing these lifestyle practices that I mentioned can help to take away some of that inflammation and reduce it and be a treatment mechanism for these chronic diseases that have not only, made COVID worse for many folks, but also, I think, illustrated an importance in our health that we have seen because of this pandemic.
We're talking with Allie Babcock here on the MegaCast. She's the Lifestyle and Culinary Medicine Coordinator over at St. Joseph Mercy Health System. And so with that, Allie, we've been told over and over, drink more water, get rest, eat healthy and exercise, but yet we still tend to not follow those guidelines. How do we change our habits? Any advice?
It's an absolutely great question. What we know from lifestyle change is that these behaviors, while we know we should do them, they're hard. It's hard to make that lifestyle change, and it requires a certain amount of self-motivation. My biggest suggestion for changing a habit is to take it one step at a time. Don't try and change every element of your lifestyle overnight and bite off more than you can chew. Start with small, measurable changes that are specific, such as I'm going to buy a new pair of running shoes and get on the trail at least one time this week, or I want to eat one plant-based meal with my family this week. So some small incremental changes that are available to us allow us to be so much more successful with those habits, and then you can just notch it up from there. And that's really what we're doing in teaching our patients lifestyle medicine principles and habit changes at St. Joe's. We want to help make all of these changes for our patients attainable and realistic, and something that they stick to, not just a flash diet, but something they stick to on and on for the rest of their lives.
I really feel like this is trying to, treat the entire patient and not just one ailment.
I agree. Really, when we think about traditional medicine, we're set up into specialties. You see a cardiologist for your health or for your heart health. You see a endocrinologist for your endocrine health or your diabetes or your thyroid. We don't necessarily work all together all the time. And really what lifestyle medicine is about is the interdisciplinary approach to preventing disease. We know so often, I think one of the biggest pillars that I have seen across multiple ages has been, mental health and the stress of COVID-19 and what that has done for our physical health outcomes. Those things are, very intricately related. And so often we're treating the symptoms of high blood pressure when we're not dealing with the root cause of, say, a very stressful event, a grief, or, a very stressful life, like such as a job or something like that. And so helping patients to develop coping strategies for those things and learn how to deal with and delegate away good and bad stress is something that we really want to help people with. It really is treating, every element of your life in a way that we can help you be successful.
So I know this is the program. How do people participate? Is it open to the general public?
Yeah, so you can have a referral from your physician, or you can self-refer. You can visit us at stjoeshealth.org, lifestyle medicine, and there is a button right there to sign up and send us an email to get started. We will see patients individually. You can come for a one-on-one appointment, or you can participate in our lifestyle medicine intensive program, which combines individual consultations with 6 weeks of group classes that go into all of the pillars of lifestyle medicine and allow you to make really significant changes in all of those pillars towards your lifestyle goals.
So with that, Allie, will those group classes be in person or virtual?
Our program is completely virtual, and we are looking to do this for two reasons. We want to be able to meet people where they're at in their homes. We found a lot of success with telemedicine and being able to have people have the convenience of seeing a provider from their own space, but also it allows us to open up access to those who may not have the comfortability with coming into the hospital still, even though we are looking forward to vaccinations and having a large percentage of our population and herd immunity take place. So right now our program will be virtual, but you could always come see us in person for an individual appointment if you would prefer.
And with that, again, we're speaking with Allie Babcock. She's with the St. Joseph Mercy Health System. And with that, too, I think this is such a great way for parents to really take control of their health, but also the health of their entire family, because we know sometimes it starts at the top. You need someone to take control, and then it trickles down.
I really, believe that to be true. I've seen more mothers who, are taking advantage of an opportunity to take care of themselves, fathers who, want to live long to be able to play with their children and their grandchildren. And this is an opportunity to take care of yourself, but also be an invaluable change agent within your family to promote new lifestyle changes. Lifestyle medicine really is for the whole family, and we have seen that through many of the youth programs that we put on at St. Joe's, such as our Nutrition Buddies program or our Shape Down Healthy Families program. And so we really want to continue to take that family first approach in helping you implement these lifestyle changes within the system of how you run your house and how you want to improve your health, but also the health of your family.
So, Allie, I'm thinking of the conversation about going plant-based. And if you have, let's say, maybe younger ones or teenagers in the house, how do you try to explain them and approach that conversation? No more hamburgers, especially going into the summer.
I would say that's probably one of our biggest questions is what am I going to do with the grill, right? And I think that for families and children, it really isn't an all or nothing approach. So you can still be going more plant-based, more plant-forward by adding mushrooms and doing a hamburger meat and mushroom burger blend. You can still be going more plant-based by having a black bean burger, on the grilling options that we add to our table. And so helping to have the conversation with families, I think about first, how do you make small incremental changes, like that small transition towards a plant-forward plate? And second, how do you make it so that it is, a testament to what your family and your children want to do? If you have athletes in the house, young athletes, I think about teenagers who really, are gearing up for summer sports. I think going plant-based really promotes, talking about how you can be a better athlete. Going in a more plant-based approach also supports the environment. And so a lot of young people are very energized by what we can do to, be better to our environment and be more sustainable. And I think that's also another great conversation point that you can have at the dinner table that talks about how we don't only do this for our health, but we also do it for the health of our planet.
And I will say, I know my sister's family, they went to plant-based and, after your body becomes accustomed to it, even if they go off of it for a day, they say they can immediately feel the changes within their body.
I think that that's a really, a testament to how attuned you become to your body and your own internal systems. And I really want to encourage everyone who, is hearing this too. It really is that stepping stone approach that we take at St. Joe's. You can have success and feel better with just one meal. We can see changes within just 2 weeks. And so we really want to be able to put forward, more plants on the plate. It can be as simple as, hey, let me teach you how to cook more vegetables so that we can have more servings with what you would traditionally make at dinner time or at lunch. And so going forward to seeing kind of all of those changes that we can happen, helping people to realize the success that they have, but also the feeling of feeling better that they may not have experienced before is part of the reason I'm so excited about this program.
So with that as well, Allie, making these changes, can it reverse a chronic disease or a chronic illness?
Yeah, so for some chronic diseases, particularly we have evidence for cardiovascular disease and type 2 diabetes, we can see reversal of the condition. What does that mean? What does reversal of that look like? When we look at the evidence for cardiovascular disease, somebody who might have buildup of plaque in their arteries and possibly had a heart attack or needed to have a stent placed, when you follow a whole food plant-based diet, implement the pillars of lifestyle medicine to reduce stress, be physically active, sleep better, we can see a reversal of that plaque buildup and actually an opening back up of the arteries. And the same goes for diabetes. The insulin resistance that is causing elevations in blood sugar and the need for potentially insulin or other medications, we can see a reversal in the need and reliance on those medications, and sometimes even a reversal of diabetes into, say, a pre-diabetes level altogether. And this has been, evidence that has existed for many years. We've seen this through many other lifestyle medicine formal programs. And really, we just want to share this message that you have another option and that you can take control over your health. And these can be things that you do for yourself and a lifestyle change that you can make to, have a different outcome than what your genetics say maybe you should have. It doesn't have to be that way.
And sometimes it starts with those small changes in your lifestyle. And if you're going to go plant-based, now is the time of year to do it, because when we go into the summer months, the fruits and vegetables are fabulous here in the state of Michigan.
Absolutely. I am so excited for all of the local produce. Asparagus is on my menu tonight for sure.
But, for some people, they'll say it's more expensive.
So I have heard that often. And I think that when we think about going plant based, it has really been a diet that has been sensationalized as needing to be somewhat elite. And I think that that is such a disservice we've done to the health and wellness of our community. The simplest, best foods for you, rice and beans, do not have to be very expensive. You can really hack that in terms of buying in bulk, buying things dried. They're fundamental across many different cultures and ethnicities and the traditional cuisines of the world. And so it's something that is really global, and we can get excited about cooking in a very affordable way. I tell folks all the time, it doesn't have to be fresh, organic produce to be healthy. You can buy frozen veggies, or canned fruit that isn't canned in syrup, or sugar that is just as good as fresh when we think about it from holistically from a health standpoint.
Allie Babcock with us here on the MegaCast. She's the Lifestyle and Culinary Medicine Coordinator for St. Joseph Mercy Health System. Allie, just another minute or two here with you on the program. Tell us again how people can sign up and how many people are you accepting into the program?
So we are currently accepting anyone who would like to come learn a little bit more about disease prevention and reversal. We can have you sign up. You can contact us directly through our website at stjoeshealth.org, lifestyle medicine, or you can email us at lifestylemedicine@stjoeshealth.org. We also are having a lot of people come through. Our first cohort will have about 30 folks in it, but we can have many more. We can take many more folks with that, signing up for our appointments and individually and kind of moving forward into future classes. So we encourage all who are interested to contact us and learn a little bit more.
So it really is about starting small. Don't become overwhelmed, and then build on those changes to make a lasting lifestyle change.
Exactly. Start small, and if you fall off the horse, get back on it. One small change is really how mountains are built and how things are made. So this is how we're going to kind of help people move forward.
It is really such a great program. And like we said, after COVID-19, so many people are now understanding more so than ever how important what we put in our body is medicine, just like traditional medicine in which we think, but also how we live our life as well. Allie, we so appreciate your time with us.
Well, thank you so much for having me. It's always fun to chat.
You too. Hey, real quickly, what is your favorite food to make, plant-based?
Ooh, my favorite food, plant-based food, I have to go with my our seasons. And so I make a mean sweet potato and black bean taco right now. So our residents at St. Joe's know I love it. Everyone loves that recipe. You can actually find it at our website and our blog as well.
See, a lot of it is just thinking a little bit differently. And, you can still make great meals that are full of flavor and texture. You just have to think differently.
Exactly. You know what? I always say I probably started eating better and had better, more delicious meals when I started eating a more plant-forward diet. So it's something to think about.
Do you ever eat a hamburger, though?
You know what? I think that's the most important question for us is I actually don't eat red meat anymore, but it really is not an all or nothing approach. And so every once in a while, if something's presented to you, I don't think people should, feel bad about taking that and enjoying that special experience. Just more about our sometimes foods, our special foods, and our everyday foods, and making that shift for people and understanding what those are.
Well, we so appreciate your time today.
Thank you so much for having me, guys.